There we go. And now it is my pleasure to introduce our presenter today, Dr. Douglas J. Koch, excuse me.
Okay.
He is the Associate Director of Teaching and Learning at the Philadelphia campus of Philadelphia College of Osteopathic Medicine. In his role, he supports the pedagogy behind the use of various educational technology tools, including Blackboard Learn, Exam Solved, and iClickers. His area of academic interest include the teaching of end-of-life issues and how medical students break bad news, computer-based testing, and online and adult learning. He completed an EDD in Educational Technology Leadership from New Jersey City University in 2020. And now, without further ado, Dr. Koch, I'll hand it over to you.
Okay, great. So let me share my screen. So thank you very much for that introduction.
You're welcome.
As Dr. Barnhart said, our talk is measuring DEI in our new curriculum through assessment and evaluation. I just want to invite people to, if you want to turn on your cameras, it's great seeing people's faces, but I respect the fact that you might not want them on also. So either way is great with us. So today on our agenda, we're going to start with the welcome. Then we're going to talk about diversity. What is it? And then we're going to talk about the importance of diversity medical education at our institution, and then some of the challenges we've had incorporating DEI into the curriculum. And then we'll follow that up by talking about the new curriculum, and then we'll go into breakout groups and start sharing our own experiences and try to do some problem solving. And finally, we'll come back, regroup, and share what we've learned. So I would like to introduce ourselves, and I'm going to pass this off to Dr. Cadet. Start with.
Good morning. Thanks, Doug. So I'm Valerie Cadet. I am an associate professor of microbiology and immunology. I've been with the Suwanee, Georgia campus of Pcom since, well, I guess I've just made 10 years, and I am the inaugural director of health equity curricular initiatives for the medical programs across our 3 campuses. Dr. Fairley?
Good morning. Thank you, Dr. Cadet. I'm Dr. Stacie Fairley. I'm an assistant professor of microbiology and immunology on the PCOM South Georgia's campus, which is our new campus. I've been here since the campus has been open, so for the past almost 3 years. And I'm also the director of interprofessional education for the South Georgia campus.
And keeping in line with our mission of educating students, we actually have a student, Heather Smith Kiskel, who has a background, a Master's of Science in Public Policy. She is one of our osteopathic medical students. That's what the OMS stands for. She's a 3rd-year student. So our 3rd years and 4th-year students are out of the didactic portion and onto clinical rotations. So as such, while she's based in the Suwanee, Georgia campus, she's currently doing rotations in Philadelphia, and today is the end of her rotation. So she's taking her exams, but she has been a part of this, and she has a strong interest in enhancing the curriculum regarding issues of DEI, and has been quite active for the 2 didactic years on campus and still active in this role now.
Great. And my name is Douglas Koch, and I'm the Associate Director of Teaching and Learning at Philadelphia, the Philadelphia campus for the DO program across the 3 campuses. I'm also the co-director of the LGBTQIA Council in Philadelphia, and I'm on the Diversity Council as well. And I have been at PCOM since 2003, so quite a while. Feels like most of my life at this point. So on to next. So what I'm going to have everybody do is we're kind of, as a group, define diversity. So if you get your phones out and you scan the QR code in the corner, maybe it's that way, or you can go to www.slido.com and enter in 875310. You can fill in text and it will show up on the screen. So what does DEI look like at your institution? I think everybody is looking at this a little bit differently. And I know we're a medical school in Philadelphia and in suburban Georgia campus and a rural Georgia campus. So it's probably different from what you're experiencing at your institutions. So it'd be interesting to see what people have to say. If anybody has any problems with it, just feel free to unmute yourself and share, or if you're having difficulty, you can just unmute and say, okay, so acknowledging progress. Hello, new people. We're just doing a little poll here. So if you want to scan the QR code here or log into www.slido.com, enter this code and you just describe what DEI looks like at your institution. I'll give it a couple more minutes. Oh, interview committee. Okay, respect. Uphill battle but climbing, that's good. Professional development, a committee. Yeah. That's a big undertaking. Improve all student success. That's great. Okay, I think that's a great start. It looks like, oh, still in the infancy. So it looks like a common thing is that we're all in the process, in some beginning state or starting to undertake larger initiatives. So, okay, thank you. So what I'm going to do is move on to the next slide. So we're going to talk about the importance of diversity in medical education. So as far as gender and sexual orientation is concerned, approximately 9 million people in the US, adults, identify as LGBT, which is lesbian, gay, bisexual, or trans. And in that population, about 3% are transgender. The numbers are probably higher, but that's what people are reporting. And this is a little bit dated. It's 2011 discrimination survey, but it's really striking. And I don't believe that anything has really improved in this time, especially over the last 5 or so years. So 19% of transgender people have been refused, just flat out refused medical care. And then the 28% who actually had medical care were harassed in a medical setting, and 2% actually had acts of violence in the doctor's office. So to me, it's just incredible how dangerous it is coming out as transgender, not only in the general population, but in a place where you think that you would be accepted and welcomed and safe to be able to get medical treatment. So next. And Dr. Fairley.
And so when we look at the disparities and we look at literacy, language, and cultural, we see that in the US, there's a significant number of people with health literacy limitations. And millions of Americans are challenged with scheduled self-care, self and family care tasks, such as following discharge instructions, taking prescribed medications. I know firsthand because I'm my father's caretaker, and healthcare provider. So I'm tasked with that. I'm given that task when he leaves his provider to ensure that he takes care, ensure that he takes his medication properly. I translate anything that the physician has said. so that my dad can understand, because all he has is a high school diploma. So we see that there's those literacy disparities amongst many millions of Americans that are there. And studies have shown that people who have health literacy are more prone to poor health. And then we have those language barriers and the challenges. And according to the US Bureau Census, there are at least 350 languages that are spoken in US homes. Studies have shown that language barriers in the healthcare lead to miscommunication between the medical professional and the patient. You have a potential increase in medical errors that can occur. You have a reduction in satisfaction amongst both the parties, whether it's the patient or even the clinician. You have a reduction in satisfaction and the delivery of the healthcare, as well as the patient safety. The patient is less likely to return to a follow-up. And with the limited English proficiency that we've seen, when you compound that with low health literacy, it has been shown to, again, show poor health status. Many larger healthcare institutions, not the ones that are in rural areas because they can't afford it, but many larger healthcare institutions offer interpreter services to improve healthcare access, patient satisfaction, and communication. However, these services will increase the cost and duration of the treatment. So a lot of these rural hospitals cannot afford, because they're already redlined. And what we've seen even with COVID-19 during this pandemic, that these disparities have been exacerbated. You had people telling, companies telling their workers to stay 6 feet apart, but it's in English. And you have 60% of your company is individuals that are Hispanic. So they're not understanding. You have all this miscommunication, so they don't see the information and they don't know to stay 6 feet apart or to self-quarantine and things of that nature, because everything was being disseminated in the beginning in one language. And we've now learned, and we saw the effects of COVID-19 in those communities where the English is not their first language. And we now know to address those issues and disseminate information from a medical standpoint in multiple languages. Overall, having a language concordant physician has repeatedly shown to improve healthcare outcomes for patients. So that's one of the reasons why it's so important to implement diversity in medical education, and particularly at our institution. Next slide. Now, race and ethnicity, when we look at these disparities, we all know that these are socially constructed categories that are critical factors in perpetuating health inequities. According to the Kaiser family, 7 out of 10 Black adults believe discrimination in healthcare due to race happens at least somewhat often. 1 in 5 Black adults report personal experiences with race-based discrimination in healthcare. As a result of all of these atrocities that have happened to African Americans since we were brought to this country, and we've experienced, there is a level of mistrust in our community. We saw this even with the COVID-19 vaccine. There was hesitation amongst the minority communities because of the level of mistrust and the atrocities, the history, the long history of atrocities that have occurred with us. So implementing diversity in medical education prepares all students, not just students of color, to become better doctors, as it helps them become more aware of other cultures, language, and perspectives. Next slide, please. So our goal here at PCOM is to develop a curriculum that would train our students to be more empathetic, more open-minded, and prepared for a diverse workforce. However, there are challenges in developing a health disparities curriculum. Next slide.
I can't believe I did that. I didn't unmute myself. So now we'll talk about some of the challenges of incorporating DEI into the curriculum at PCOM. So what we've experienced is we have a lack of diversity in the faculty and staff. And part of that, I think, is a result of our success, and that a lot of people are hired and stay for long periods of time. So we have people at the institution have been there for, like me, almost 20 years, 30, 40 plus years. We also have to get buy-in from like the highest levels down to the lowest levels. So from like the provost and the board down to individuals to buy into the need to address issues of DEI. We also need more concerted, focused faculty development and staff development at the institution. In the medical program, we were previously the medical program across 3 campuses in 2 states, kind of running with our own department heads, our own course directors, our own deans. Some of the programs were aligned in some ways and not in others. So that made it a little bit difficult. We also had a distributed administration. We're currently understaffed since we have a new campus in Moultrie, Georgia, and that's growing. And we also have limited DEI measurement tools at the moment. So I'm going to pass this off to Dr. Cadet.
And the same thing almost happened with me and this mute. It doesn't matter how long we're in Zoom world, I'll never get it. Thank you. So since then, with all of these challenges that Doug has just outlined for us, coupled with, a lot of the concerns and issues that Dr. Fairley has outlined regarding, the disparities in healthcare and biases, depending, really relating to DEI, we had to implement change at PCOM. And, PCOM has attempted to improve conditions regarding DEI for some time. For instance, in 2014, they hired the first chief diversity officer, went on to create the President's Council on Diversity, Equity, and Inclusion, a council that I have been co-chairing for several years now. Since then, since the inception, the LGBTQIA Council has been created and maintained across the campuses. And the Office of the Chief Diversity Officer has actually been expanded and continues to be expanded by adding additional members of the staff across the campuses and upgrading their responsibilities to help enhance the overall campus climates, as well as work within the curriculum to try to do more integration that way. So next slide, please. Thank you. So what I wanted to do, if you were to think back to a lot of the particulars that Doug mentioned in terms of challenges, was sort of bring you through how we've begun to address these. So every 5 years we have a strategic plan, and that is done, as I'm sure in most institutions, with input from just about all the constituents. So within our 2025 strategic plan, there have been components that were already put in place when this was released in 2020 to begin to attract and retain a diverse student body. PCOM, generally speaking, is actually a bit more diverse in our medical programs compared to other medical schools. However, we still have a long way to go in terms of particularly retention of minority students. And a lot of that tracks back to many of the factors that Dr. Fairley has mentioned. So then also, in addition, as we're looking at the lack of diverse faculty and staff, that was put into the strategic plan as well, that we need to recruit and again, retain, strive for mentorship and promotion within the faculty and staff to maintain that diverse or create the diversity. We also want to advance our students' market competitiveness because we want to prepare them to be successful in culturally responsive practices. Dr. Fairley outlined some very key points here about language, about culture, about level of education, just to name a couple, that our students need to be prepared to work and help all people, regardless of those scenarios. And so that's part of our strategic plan to enhance these factors. And then ultimately enhancing a climate of respect and inclusion. We've got to be able to do this across our campuses, working together, meeting our differences. It was highlighted that we've got Doug mentioned that we've got a campus in the South Georgia area, which is a rural area. We've got the suburban community that I'm in North Metro Atlanta. And then we've got the Philadelphia, city, inner city location. I mean, it's a really wide community of people. So we have to be able to, across the campuses, as well as within our campuses, and then more broadly, our communities, because otherwise what are we here for? Be able to enhance that overall climate of respect and inclusion. So next slide, please. So that was part of our strategic plan. That was released in 2020. We all actually worked on it in various ways. They brought in outside consultants for various parts of it, particularly the DEI aspect of it. It was released pre-COVID, in fact. But COVID has highlighted so many disparities, so many inequities. And so there's more that has to happen, particularly in light of the social injustices that have been evident to some, but not all. So they basically come to light after the killing of George Floyd. And that led to a point at our institution where there needed to be distinct change. And so as a result, the President's Commission on Racial Justice, Transforming Campus Culture, was created. This was a series of work groups that you could see listed on the slide that were created to but to identify particular issues and work to come up with solutions for those issues in line with our strategic plan, but immediately right now. And those are representative of students, faculty, and staff across all of the campuses together, working together in this one PCOM that we have been transforming to try to be. And so this particular commission is to advance our commitment to justice, equity, diversity, inclusion. It's chaired by our chief diversity and community relations officer. And it's tasked, each work group is tasked to closely work with the chief diversity officer, external consultants, identify chairs, and identify strategic priorities and initiatives aligning with that PCOM 2025 plan. And I'll add, so another component that has been created directly by the president that also is in line with our DEI mission. And all of this is to complement our curriculum and overall essentially lead to our students being those culturally competent, inclusive providers we need them to be regardless of the field. It's the president's wellness initiatives. And so the president has again created this initiative with funding to support DEI missions. I'll give you one example of that. My research since COVID has pivoted to COVID, and one component of that is addressing the hesitancy in minority communities particularly. I live in an area which is considered a minority county with many languages, but a high population of Spanish-speaking individuals particularly. And so the institution instituted a diversity faculty fellowship, which I was one of the recipients of. And my project was an interprofessional project dealing with students from the pharmacy, the biomedical sciences, and our osteopathic programs, which specifically went out into the community in churches and at health fairs and other aspects to speak to people, meeting them with we're a multilingual team, to try to address the hesitancies and the concerns regarding the COVID-19 vaccine and increase uptake. That's directly supported by our institution. And we've been able to integrate part of that into our curriculum. For instance, we have a medical humanities course of which I'm it's a new course. I am the course director for that. And we've been able to bring that supported by our institution into our curriculum as well. Next slide. Next slide, please. Thank you. Dr. Koch, I'll turn it
And
back
I
over
mute
to you.
myself. Oh. So in addition to the work groups that have been created, we're also doing a lot of training and development. And we've been doing this over the years, but it's picked up pace. So one that's been going on, I believe the longest, is the safe space training, which is one that I've been involved with. It's a modeled after the safe zone training offered by the University of Rochester. We have created our own in-house, based on our own experts, program, and we've been offering it face-to-face, but since COVID and the lockdown, we've been able to offer it online, which opened it up to more people. We were able to do it on all 3 campuses for anybody who was involved. We've offered it to individual departments, whole departments like the library and admissions, as well as individuals, faculty and staff, and even students. Last year, we started an Unlearning Racism program. I was in the first cohort of that. It's about 12 weeks long, and it follows the book Unlearning Racism. It's made up of groups of about 12 people. And it's a really powerful, moving, emotional experience. And I found it very transformative. I found that it's helped me listen to people in a different way. My husband is Puerto Rican, and I just realized, like, I've been thinking more and more about the way he says things, and I've just taken for granted what he's saying. I've been taking things kind of at face value, and I'm listening to him in a different way now about his experiences, and it's actually brought us together closer. So on a personal level, it's been as far as relationship goes, it's been a great program. But I think I'm listening to students as well in a different way, and just the people around me, and acting differently. We also started a microaggression training module that started last year. It was done online through Blackboard, and it was offered to our incoming residents and interns through Human Resources as their employees. And there was a couple hundred of those, as well as our second-year students who were getting ready to go into the third-year rotations, of which there was probably about 300 plus people that went through that. We also have compliance training through Safe Colleges, and our Department of Diversity and Community Relations is going to be starting a cultural competency certificate that starts next year. And it will be composed of, I believe, 6 different units, and people can choose to take one or all of them. And at the end, they can get a certificate, which they can use as part of their human resources file, and use that as part of their performance management.
So with our unique challenges, some of them being that a big one when we're talking about curriculum, being that we are in 3 locations with 3 different, city, rural, all of that settings, as well as a distributed administration. So first of all, we had 2 curriculums. With our South Georgia campus coming on board, they aligned with one of the curriculum, but essentially we still had 2 curricula separately. We had a completely distributed administration of that curricula. While we have some shared administrators for the college, of course, it's one college, we have individual campus level and programmatic deans. We have different, space issues or concerns. And so carrying things out was different. Our curricula were not identical in terms of, even when we had the same courses, sometimes we had different content within the courses, and we also carried them out, not at the same time. So when I say the same time, meaning some courses might be, a second-year course, first term for us in Suwanee was actually a first-year, third term course for Philadelphia, for instance. So what we decided to do as we were coming together as one institution, knowing we needed to make these changes, was the creation of this PCOM1, as Doug mentioned earlier. And so with that, we condensed our curriculums into one. So all of the faculty came together along with our administrators, and the content experts sat down and really decided what content, number one, needed to be included for each discipline. And then where is it best placed, first year, second year, and then perhaps within which courses, once those courses that we were going to stick with were defined. So that, in addition to deciding how much time was needed for each, within each discipline and within each course, was decided by discipline experts. The courses themselves, in terms of the different administrators for each campus, we decided, as we're PCOM1 and we're running one course across 3 campuses, there would be a shared course directorship. And so there's defined roles for each of the course directors. And so there's a course director for each course on each campus, and each individual faculty member would have one role that would serve across the campuses. And so the students themselves understood that we are one institution, we're one program now as far as the medical program. And so while generally the teaching, the actual didactic teaching comes, from faculty within the campus, we are going to have aligned learning objectives, aligned tests and exams, quizzes and all of that stuff. And so of course we have to continue to talk to the students to make sure that they're getting it and understanding it. So in addition to that, with that overall distribution of the administration and the different deans and all of that, there was the Medical Education Center of Excellence that was created this year. In fact, I'm the inaugural Director of Health Equity Curricular Initiatives, which actually was a position that spun out of the President's Commission. One of the work groups, which specifically was looking at curricular initiatives, determined that we needed somebody to focus on DEI specifically in our curricula, because as somebody mentioned when we were, I call it a word cloud, but essentially when we were all typing in our own personal thoughts on DEI at our institution, we need a lot of professional development and training. And so faculty need to be taught as well as helped. One of our concerns is that we have understaffing. We are understaffed. This is a huge undertaking. South Georgia is a very small campus. Mine is slightly larger, but essentially all of us with this type of curricular overhaul, we're overworked. And so we have to expand staffing. And that has been something that they have decided on. In addition to focusing on diversity, we're going to expand staffing to be able to meet all of these particular objectives that we're trying to do. Next slide. Actually, I want to take 1 second, if I may. I don't know that I completely defined MECO. MECO itself is actually the overall administrative sort of oversight of the curriculum, composed of 5 directors across the campuses and all of our deans, specific deans, as well as the associate dean of curriculum. So that was a position that was created several years ago as well to help oversee the entire thing. And so with this type of spanning across multiple states and this distance, that body is to ensure we're meeting all of the objectives and implementing it specifically. Now I'll turn it over to you, Doug.
Thank you. So now we're going to go into breakout rooms. We're going to do 3 of them. So I'd like to everybody, when you get into your group, I'm going to assign you randomly, talk about a problem that you might have. Share one of you share a problem that you might have right now with trying to implement, DEI and how you would measure it, and then brainstorm how you might solve that problem. I'll give you about 10 minutes, and then we'll come back and we'll share what we did, what we learned as a group, and then I'll collate or take notes. At the end, I'll share what we've learned with the group, and I can email that out to you if you'd like. So right now, I'm going to break you out into groups. Maybe I need to stop sharing. Okay, breakout. Okay. Okay, here you go. And I'm gonna move some people around. Oh, just to. Oh, I didn't. Thank you. Let's see.
Hi, Doug. You had me assigned to group number 1, but there was no one in that room. Did he jump back out, Wendy?
Sorry, I was muted. Looks like he jumped into room 4.
Yeah, I can't see any. The only breakout room I see is the one that he wanted me to join, but there's no one in that breakout room
Yeah.
number 1.
He only had 2 people assigned to that room, including you.
Okay. Oh, so me and Valerie. Doug, I
wanna
put
go to-
that question in the chat, so they should see it all in the chat.
Okay,
Yeah, I sent it to everyone.
okay. Did you want to go to a room, Stacie?
No, I didn't. I just saw where you asked me to join a room. So
Oh,
I was
okay.
like, I can go in there and moderate the conversation and drive, push. them to-
Okay, I'll send you to, how about room 2?
That's fine.
Okay. Let's
And
see.
Jennifer just joined us as well. So Jennifer, do you want to go to a room?
Hi, Jennifer.
I don't see a microphone by her name, so I don't know if she has
Oh,
audio
okay.
on.
Okay. We'll wait. I see Kelly has not been assigned a room, so I'm going to send her to room 3. Michelle has not joined, so maybe I'll send her to room 2.
And Jennifer just left us.
Oh, okay. So what do you do down there?
I am dean of all of the health, education, and cosmetology programs at the college.
Oh, neat. I have a neighbor who works at it's not like a vocational school,
Mhm.
and they have a cosmetology program there. I always think that's interesting.
Yeah, I
When
have
I
all the
was-
fun programs.
Yeah. Years ago, it's interesting. I was let me see how much time they've been in there. Years ago, I was involved with computer-based testing, and they had all their training on YouTube. And I was watching them, and YouTube would come up with suggested videos for next. And it was always like the next one in the training series. And one time it was an acrylic nail training video. I go, how did that? So I watched it. I thought it was really interesting. It's this whole online community of people who don't have any experience in education. They've created this online community of practice. They've monetized their videos. They've found royalty-free music. They're sharing experiences, creating content, doing new techniques. It's just amazing what's going on out there, just with people who don't have any formal educational background. I've just been fascinated by that. Yeah, that just still amazes me that, these things happen just out of the blue with the technologies we have. And then we're still teaching face-to-face quite often.
Right.
So.
We still have a lot of students who prefer the face-to-face.
Yeah, and there's definitely a space for that. But, we can definitely, I think, incorporate more to give, to be more inclusive and to allow people to have their adult lives, some flexibility there.
How long are you doing the breakout room for?
I might do it just a couple more minutes. I'm going to jump into one and see how they're doing. So I'm going to go into 2
Okay.
and see how they're, maybe 3. Nobody's there from our group. I'm going to give them 2 more minutes. Set alarm for 2 minutes.
I think we had some people who just entered. So if you just entered, we are in breakout rooms for another 2 minutes.
I'm going to assign this person to 2. Stopwatch. And timer 2 minutes. How many students do you have?
A lot.
A lot, okay. Well, that's great.
Yeah. We have around 200 in our nursing program.
Oh, wow.
And probably around 200 in cosmetology and about 250, well, no, around 400 in early childhood.
Wow.
Yeah.
That's amazing. It's an exciting time, I think, for community colleges.
It is.
Yeah, I've kind of thought about, at one point I was thinking about switching over to community colleges, but
Mhm.
at this point I feel so invested in medical education that it's
Yeah.
be a difficult change. I think there's a lot of differences also.
Oh, yeah, it's
Yeah.
a big difference, but I love the community college level because it's such a leg up for people who ordinarily would not be able to go to college.
Right. Yep. That's what really speaks to me is
Mhm.
that really meeting the needs of those learners in a different way.
Right.
Yeah. So okay, close the rooms. Oh, here they come. Looks like people are coming back. Okay,
I think that was great.
looks nice out there. Here, Nikki. Here's everybody back. Hello, everybody. How was that? Good. Does anybody want to share what they discussed? Any?
I'll go first.
Okay.
I was going to pop them in the chat, but this will be easier.
Okay.
So we started off our discussion by talking about the downward trend in enrollment. And I just want to mention that I feel like this is exacerbating the problem because a part of what I'm hearing a lot is how we're all overworked and being asked to do more duties. And to me, that comes in combination with the pressure that we all feel because enrollments are down. And I know of many colleges that aren't in that boat, but I know of many more colleges that are in that boat. So I wanted to acknowledge that right off the bat. And our team did mention that these are historic trends that we knew were coming. I had actually heard about that too, right? Because the population of high school graduates is down. So that was just interesting to start the discussion with that. I thought that was an important context. So one of our team members talked about the commitment that she has at her institution, that the president and the vice presidents are all committed to this. I get that same feeling at my institution, but that people below that people want to do the work, but don't always know what to do, which reinforces what we heard earlier about the need for professional development. And that came up again and again in sort of different, with different concerns that they could be addressed with professional development. At the end of our discussion, in fact, it was recommended that institutions look at having closed days dedicated just for professional development, so that if that's something your institution isn't doing, and I think it's really important that institutions do it meaningfully. Don't call it a closed day, but yet the bookstore has to be open, because bookstore folks interact with students more than, right? So if that's something you can advocate at your institution, just make sure that they really are committed to having closed days for professional development, and with activities and workshops and trainings that can help address these concerns. Another team member talked about a book club that she participated in across institutions in Montana. And the book that they read, which was recommended by 2 team members, was Equity Talk to Equity Walk. And I had not heard of the book, so jump in, Jackie or Christina. But it sounds like it has practical steps, information that you can take to the bank as you read the book. So they highly recommended that, Equity Talk to Equity Walk. And then I'll just mention that, all of our team members concurred that we're overtaxed, we're overworked. So trying to find a balance of how to fit these things in is a big concern for all of us. I think I captured, help me out, team members, if I missed anything.
That was awesome.
Well, thank you very much. Those are great ideas. I really like the idea of a closed day, a really dedicated day to something like this. Oh, I see that Jackie sent the name of the book, From Equity Talk to Equity Walk, expanding practitioner knowledge for racial justice in higher education. And then there's a link to Amazon. Is another group would like to talk? I think there were 4 groups, or 3 groups tonight. Hi, Ellen. Anybody else have any ideas or want to share anything? I know one group was talking about how they're really at the beginning of this and just have set up committees. And that's kind of where they are at the moment, which is a great start. Okay, anybody else maybe? Oh, okay, so how about if we go in, well, we can talk about what we're doing at our institution as far as a curriculum approach is concerned. Did Dr. Fairley or Dr. Cadet want to talk about that?
Sure, I'll talk about it if you don't mind presenting the slide.
Here we go.
So at PCOM, what we wanted to do, the first thing we needed to do was assess where we had our DEI efforts and deficiencies within the curriculum. And so the part of the task force that Dr. Cadet mentioned earlier, the working group, one of those working groups dealt with curriculum. And what they did was create a survey and sent it out to all students as well as faculty to see whether or not DEI was being implemented successfully within the curriculum and where were we implementing it in the curriculum. And once we got those results back, then that showed us where we had huge gaps in the curriculum. And also that there was need, as Dr. Cadet said, for more development and training with our faculty, because some of our faculties, the definition of DEI was different across the board. So we looked at those things, and we now know that there are certain areas, such as in the area where I'm at, that I'm the director of, which is Interprofessional Education, DEI is completely immersed in those modules that we do with our students. However, in other areas such as in primary care skills, we noticed that there wasn't a lot of DEI. So our curriculum was changing in essence to ensure that we start to implement or incorporate some of the DEI, see where we can put DEI in, because as we know, medical school curricula is already jam-packed. So trying to find out where we need to put that in and then implementing that has been a huge undertaking and task for us. Additionally, what they did was come up with a diversity statement to be included on all syllabus. So we have this new curriculum that we're rolling out across all 3 campuses, as Dr. Cadet mentioned earlier. And so we had a standardized format as it pertains to our syllabus. And so we also included a diversity statement that even on our South Georgia campus, the students on North Georgia campus, as well as on the Philadelphia campus, also got these exact same diversity statements. So now our voice is becoming one. When before we were 3 campuses with 3 ideas, now we're 1 campus, 1 PCOM just on 3 campuses. So now we have this one voice that says, this is what these are our expectations as it pertains to DEI within the curriculum. And these are the expectations that we have for the faculty, as well as the expectations that we are going to ensure that the students learn. Additionally, in some of the courses, we saw that the low-hanging fruit for us could be just something as simple as using diverse images. A lot of our faculty members were unaware of different websites like Black Twitter or different books where you can find these different diverse images. And that was because we were 3 different curriculums on 3 different campuses. So now we're all sharing our resources and we're all using different diverse images where we can within the curriculum to ensure that our students not only see a disease manifestation on a Caucasian student, but they also see it on an African-American skin pigment tone, so that they can understand that their patient population is not just going to be one race, it's going to be multiple races. And they have to identify those things. And we've seen in the literature where African-Americans have been misdiagnosed so many times or undiagnosed because we haven't taught them at the medical education level to look at different, to see different disease manifestations.
Yeah,
If you want to add, Dr. Cadet?
Yeah, so in addition, as a for instance, and so this applies to us as a medical institution, but you know, I guess I would challenge everybody to kind of think outside the box and see how it can work, or, you know, for yours. So our students have a clinical simulation center, you know, where they're actually using mannequins that are programmed. In fact, we have a medical simulation program where our master's students learn how to do all of that. And simulation is a way that a lot of medical facilities are going towards it, and training institutions to help the students learn. Well, we need to bring diversity in our mannequins, you know, number one. There's lots of things, and that's not something that we had before. So even actually purchasing additional mannequins of various skin tones, various sizes, because it's not just skin, but that's a huge one, but sizes as well. That's one example. And then, you know, something, and I do see, Nicole, that you asked if we could perhaps share the survey, and we can go and look up the questions and send them out. I will say what's interesting is that, you know, there's 2 very clear questions pertaining to diversity on the survey that we used this term as a course eval, because we realized in the past that, first of all, we were giving different evaluations at the end of a course, but second of all, we weren't even asking questions within our overall at the end of a course evals to see if we're even incorporating. So now that it's on the forefront of our mind, we've added 2 additional questions into our eval. And then we've had the survey themselves, so we'd have to go back to look at those survey questions that went out initially to faculty as well as students to see what, to see, you know, what's in there. So we'll look at those and we'll send those out as we can. But what was interesting is that we have there's a split between what the students perceive and what our faculty and staff perceive. So even as we're looking at the same topics, students see it one way, and faculty think that they're doing more than students see. And it could very well be that that is exactly the case. However, it could be the opposite too. And so that goes back to educating both students and faculty and staff in what are these terms? What do we really mean when we say DEI and incorporating it into the curriculum? So there may be an assumption for those of us who work in this field, or those of us who've had the opportunity to do the work and get to learn. But I guess one thing that I pull out of all of these surveys is that, and the results, and when you compare them, that we have to all take a step back and make sure we're speaking the same language and take a time to educate our students along with faculty and staff that are implementing what it looks like, what we're really saying, what are these things. And so don't assume, I guess, is probably a big lesson that we've learned.
Yeah, and it's amazing how much easier it is to get resources than I think we originally thought. Like Stacie mentioned, Black Twitter. There's also a lot of resources on Instagram. I'm just amazed what you can find there. Pinterest is something that I get stuck in and I can't get out of, so I won't go back in there again. But I'm sure there's a lot of information there as well, just images that you could find if you're looking for diverse, skin colors with, just different diseases or whatever is that your subject area is. But also in our sim lab up in Philadelphia, we decided that we wanted to include more diverse patient population. So I reached out to a friend of mine who has a connection to the trans community. And, we thought we might get somebody who would respond and be interested in being a standardized patient. We had 50 people, contact the office. They were just completely overwhelmed in a great way. But we just would never have imagined one simple email would result in that much interest. So don't be afraid of just, finding a contact and doing something that's just, reach out and touch somebody and say, can you help? People are really willing to do that. So, so let's go to the next slide. So we're going to go into another breakout room and we're going to talk about ways you can identify gaps and opportunities for DEI measurement in assessments. So in the tests that you do, or if you have experiential learning, what are you doing or what could you be doing to help implement DEI in those areas? So I'm going to stop sharing so I can break to the breakout rooms again. So let's see. Let's see if I stop it after, oops. Here we go. Okay, looks like I'm going to move Robin from room 2 into room 3. So we have 2 rooms at the moment, one with 4 and one with 2.
I'm not in a room.
Who is that?
Nicole Lawson.
Okay, I will move you then to room 3. Thank you for letting me know.
Which room has 2 people in it, Doug? Was that the group you had put me in?
Okay, I'll put you in. That's group 3. There's 3 people there now. I'll move you over
Oh,
there.
no, that's fine, that's fine.
Okay, yeah. And then Valerie is in room 4.
Okay, what about Primrose and Daisy? I see them at the top.
Yes, yep. This time I put the timer on, so they got 6 minutes and 30 seconds to go.
Right. Yeah, I think they're very curious.
Yeah.
Wendy, do you know the institutional demographic of the individuals that have registered for the conference? Are most of them medical education? Don't forget.
I'm going to mute my dog.
And Doug, you're going to discuss the assessments, right? Okay, great.
Yes. I think everybody is back. So hello, welcome back, everybody. Would anybody like to share what they discussed in their time together in your group?
Hey there. If I can I was asking this question as we were slipping back out. If I can
Okay.
put Jackie on the spot to talk a little bit more and expand on what she was saying, because we actually were talking about some other stuff. And so we got cut short a little in terms of the assessment stuff. And there's another question that I want to ask you, Doug, later for the whole group. But
okay.
I sort of touched on how we're measuring it just a little bit, kind of DEI broadly, and some of the challenges with earlier with the fact that students, faculty, staff kind of look differently. But Jackie brought up something that I don't believe we're doing that would be amazing in assessments.
Okay, I'd love to hear that.
Yeah, so I manage all of the course evaluations for our continuing education and our curriculum folks. So that's two different sides of the house. And both of those course evaluations have a question of the instructor made me feel included. And we also have a question about like the instructor treats everybody fairly or applies course policies fairly to assess so that's that side. But then we also I'm currently working on our analysis for our student climate survey. And in it, we created a subscale for sense of belonging and inclusion. And those both scales is reliable. And so we asked questions about, do you feel welcome? Do you have somebody you can talk to? Have you considered dropping out because you don't feel welcome? Different things like that. It was around 6 questions, so 3 for each subscale. And we straight ask students, do you feel welcome here? Do you feel that we're committed to equity and things?
That is great. Yeah, Valerie, we're definitely going to talk about that later. So did anybody else want to share? Okay, well, I can share what we're doing at PCOM. So we have a question and assessment review committee. And what the committee is doing is looking at the questions to make sure there aren't instances of bias in the questions, making sure that, I think Stacie had a great example of not all the patients that go to the ER with, drinking, over drinking or from, frats and stuff like that, these white frat boys, or, all the patients who had sports injuries aren't boys. So we're looking at things like that, not all women, people who present as women are having children. Sometimes it's a male somebody who presents as a male can have a child or need an OBGYN exam. So we're also looking to see if we can make sure that the questions are evenly distributed with gender within the questions. And also, like we mentioned before, in our content in the curriculum, about having diverse imagery. We have people using questions over and over again, and earlier, in the past, it was mostly images of Caucasian skins with different infectionless skin, things like that. So we're looking to increase the diversity there. And our library has identified a resource that's available to everybody, like a dermatology resource and another one as well, so we can have more diverse imagery there. We're also looking to figure out how we can tag our questions. We use ExamSoft for computer-based testing, and most of all of our tests are computer-based tested or testing. I'll find out what derm resource we have. If you email me, I'll get that information for you. But we use ExamSoft for computer-based testing. So we're looking to add a tag that has something to, that indicates diversity component. And we're looking at how we can do that and how we can look at linking that to our curriculum mapping. I've reached out to a couple of places, and it seems that we might be the only person looking at this at the moment. So if anybody out there is interested in doing something like that also, I'd love to partner with somebody at a different institution and maybe come up with a way of doing it that's more generic, or do a research project. So those are some things that we're using to address diversity in assessments. And then the last breakout group is going to be the third one. So what are some ways you can identify gaps and opportunities for DEI measurement in your evaluations? So for us, we have course evaluations, and for the students, and Valerie, I believe, mentioned that there was ones the faculty are evaluating things also. So are there gaps or opportunities that you have in those areas? So I'm going to stop sharing and send you into breakout groups again. And I'll probably only, okay, I'm going to send you out, and I'll probably move you around if it's not broken up evenly. So I'll see you in about 8 minutes.
Interesting.
So welcome back, everybody. Would anybody like to share what they discussed?
You can totally say no, Pamela, but you were in the middle of sharing where your institution is at. Pamela joined us a bit later, and we got her up to speed with some of where we've been thus far, and she is in New Jersey. Am I right?
Yay.
Yes. Well, put it this way, I don't live very far from the Philadelphia Pcom, but I work in New Jersey. So,
okay.
But what I was saying was at our institution, our committee is basically in its first full year of operation, and we're spending time on our strategic plan and our mission, mainly because we have an eye down the road to assessment and evaluation, and we feel that that strategic plan, that mission, that vision is essential to being able to build any kind of evaluation and assessment. So we're starting at the front end with that in mind.
Okay. Well, that's great. Maybe we could talk sometime. I'll reach out to you. That'd be great. Where are you? What school are you at?
Mercer County Community College in Trenton, New Jersey.
Okay, great. Yeah, not too far. I go that way when I go to my parents. They're up in Basking Ridge. So yeah, great. Anybody else?
I can share briefly. I think Primoz was asking me to share about, we have 3 questions in our course eval. that we've just built into our course evaluations around EID.
Okay,
One is around like, one is around our patient cases, the diversity of our patient cases, does that support students learning, and is it, effective and appropriate? Another one's around the inclusivity of teaching materials and resources. And then another one's around the learning environment and feeling included in the classroom.
okay,
Space. So we have a few kind of targeted questions that we're just iterating, right? This is the first go round with these, trying to hone in on the key areas or issues that we've seen with students and how to get their, get some consistent feedback on that. So that's what we're doing in our course.
that's great. So here is what we're doing. And I think Dr. Fairley.
So yeah, what we're doing is we've created an evaluation, and we're still working on revamping these evaluations, but we have included 2 open-ended questions to see whether or not our faculty members are using culturally appropriate terminology during the learning sessions or on any of the learning materials, as well as whether or not the faculty member presented variations in the disease. And it goes back to what Doug, myself, and Dr. Cadet have been talking about, is the use of diverse imagery, as opposed to, it's easier. I just finished teaching in a class, the dermatology course, and it was extremely easy for me to find disease manifestations on Caucasian skins, but on various other different skin tones, it was hard for me to find it. And I think I put in a link the books that I was able to, and resources that I was able to find where there were diverse images. The Atlas book is a dermatology book. Brown Skin Matters is a Twitter account that has the different manifestations of diseases on various different types of pigmented skin tones. So I was able to incorporate that into my lecture, but it was extremely hard to find those resources. I will say that it was extremely hard to find that. So those are the 2 open-ended questions that we've put on our evaluation for our students to comment with PCOM. Is there anything else you would like to include, Dr. Cadet?
Well, actually, no, I think that's it. Those were the 2 that I was alluding to earlier. We're still waiting to see what that looks like in terms of the final eval. We know that when we surveyed students and faculty and staff that are involved in courses earlier on, there was discordance between how they viewed things. So we knew that at the very beginning going in. And so I think, as somebody just mentioned a little while ago, it's sort of our first round approach to see, well, are we even, are we getting anything out of this? Do the students, I should say, feel like we are doing these things? And in fact, is that matching as we review? So that's just where we are right now, step 1, first term, literally. And we are a trimester system school, so we just ended our first trimester. And so we'll be looking at the data analysis shortly. What I did want to bring up earlier as a challenge that was mentioned in our group, and I think seconded by multiple people, was a concern with adding, I guess, a concern with actually measuring it in evaluations and truly assessing it, is that as faculty in most places are overwhelmingly white, they have a desire to do better. They have a desire to ensure that, that's my words when I say do better. How do I say that better, I guess? They have a desire to meet these objectives, these DEI objectives. However, they're hesitant about putting this component in assessments because of the fact that they don't necessarily know that they have all the tools they need to successfully do this. And so then if they're being evaluated on something that they don't feel necessarily knowledgeable enough about, then that can affect them negatively. But the desire is there to actually meet these metrics. So then that actually, though, goes back to, kind of what we were talking about a bunch of times earlier, in that we need professional development around these topics and these issues and concerns to really comprehensively move curricula forward and student learning and outcomes forward in this. that's what I wanted to add on it. Specifically, there was a question that came out in one of our groups earlier that kind of goes to this DEI with our students question that I mentioned I wanted to ask you specifically, Doug, to answer, and then Dr. Fairley to weigh in on. I was looking, I wrote it down. So I'm going to say what I remember because now I can't find my notes. And then I think it was Jackie, perhaps jump in if I didn't capture the question right. But what the question is we're kind of looking at is, you know, as you have students who may be changing names or changing genders or changing genders, I should say. So overall changing their identity. How are we capturing that and on the IT end, and then having that integrated into our courses and course directors and rosters? And Doug, I know yesterday we were you're muted, by